to be here with you today. My name is Reverend Dr. Q English, and I am the President and CEO of Elevate Health. I'm also a past appointee under the Biden-Harris administration, where I served as the director for the Center for Faith-Based and Neighborhood Partnerships at the United States Department of Health and Human Services. I also co-chaired the Maternal Mental Health Task Force at Health and Human Services, and so the journey was extraordinary. It was also there that I created something called the Moms Tour, and it was a tour where we went to areas with high maternal mortality morbidity rates and connected pregnant and postpartum women and parents and children to services and resources real-time on-site, actually building a village model so that long after I returned home to DC, they would still have the support that was needed. So that was really an exciting journey. We had, our work was highlighted by Vice President Kamala Harris as an accomplishment for federal, under her reign, I should say. We connected over 20,000 pregnant and postpartum women to needed services and resources. Over 3,000 were connected to mental health care services, and we expanded the perinatal workforce by almost 600 culturally competent doulas. So it was an absolutely amazing journey. Okay, so let's get right into it. I am interested in knowing who's in the room. And so I would like to know, is there anyone here that currently does work in the maternal health space? Okay, what type of work do you do?
I am a midwife.
Midwife, yes. And LDS would know a lot about midwifery services because they sort of led that movement in the 1800s in strong midwifery care, and I've been honored to partner with them even on the Moms Tour when we launched it in federal. Anyone else doing any kind of work in maternal health? Okay. Then one person, two people. Why are you here? What's intriguing you about this conversation? Yes.
I just think it's so sad that at this point in history that maternal health and well-being is going down instead of up.
Yeah, I'm with you on that. Yes, sir.
My wife went through 4 C-sections, and I have 3 daughters. Interesting.
Wow. Yeah, my personal story is my daughter had complications, and they were preventable, and the first time they weren't supposed to give her a C-section, and they did. And so this is definitely personal for me as well. So we're going to dive right in. Okay, so this is not my computer, so here. Okay, look, real quickly about my organization. We imagine a world where everyone, regardless of their background, circumstances, or zip code, has an equal opportunity to achieve optimal health and wellness. So we really exist to address the social determinants of health by connecting faith, community to resources and services in an effort to improve their own public health outcomes in their community. So when you think about reimagining the different types of partnerships where you're not so heavily reliant on federal, so I'm looking at philanthropy, we're looking at foundations, we're looking at public-private partners, learning how to move in that, and moving toward more of a community-driven, village-sustained model. Right? So it's not so heavily weighed on the top, but we're driving it from the community level. So to that end, I created something called the 100 Million Reach Collective, and that collective is many of the top leading faith leaders over denominations whose collective potential is to impact close to 100 million lives. So you saw our Bishop Sheard out there, he's part of it, so I have him and others in his ranking that's a part of it, including Reverend Dr. A.R. Bernard and others that you may or may not know, but it's all about how do we make the most impact. You know, I understand you can reach 6 million, I can understand that you can reach 20 million, but what if we all brought our collective power, influence, and reach together to impact 100 million lives. Second thing that's real passionate about is my Thrive Tour. And the Thrive Tour is just a spin-off of my mom's tour, where we actually go into these communities that have high maternal mortality and morbidity rates, right? And then we build the village. The village in many of these cities already exists. And we just bring them to a central location. A lot of it is hosted in houses of worship. Central location where they then connect to these pregnant and postpartum parents. And the way we get them in the door is through an amazing community baby shower, right? That's the way to get them in the door, because once they're in the door, they're mine. So it's all about education, education, education. We're empowering them. We're teaching them how to advocate for themselves in healthcare settings. We're teaching them what is the role of a doula, what is the role of a midwife. We're talking about postpartum depression. We're talking about, hey, your doctor keeps sending you home over and over and over again. This is your 9th time going home. Perhaps we need to learn how to fire our doctor. And so, we have these real conversations, but what's really encouraging to me is what happens afterwards, all these connections. I am going to say the behavioral and mental health space of connection has been really at the top of the list for those that are part of these gatherings. And then we have a separate dad's den. And we do that because it's not I'm pregnant, it's we're pregnant, right? And so they too have their own things that they're going through, and suffering and postpartum depression, et cetera. And many people don't talk about the dad, but the dad is a vital part, right? We don't throw those community baby showers for dads, but we do on the Thrive Tour. And then the last element of that is actually creating work. Now we've added, the reason why we call it Thrive, because it's the workforce development. So not only are we looking to certify doulas, right, but we're also looking to help those that are struggling with jobs to develop. So we have this workforce development component that's beyond minimum wage. It's living wage or higher. So we're real excited about that. And so those are just some of the things that we're focused on. Mental health is still part of our wheelhouse. I actually brought together all of the leading models that exist in houses of worship that have amazing mental health. When I was in federal, that's what I'm talking about, have amazing mental health ministries, and some have mental health clinics right in their house of worship. And so we are doing that as well, because it's not just maternal health, as I mentioned, it's maternal mental health that we are also focused on. So let's go right into it. This is what really drove me. So my 4 areas of focus when I was in federal under Biden-Harris, it was maternal health, mental health, suicide prevention, and substance use disorder, and the ongoing work around COVID. But to know that the U.S. has the highest maternal mortality rate than any developed nation in the world, period. U.S., us. Black women pregnancy-related deaths are 3 to 4 times higher than their white counterparts. American Indian, Alaska Native pregnancy-related deaths are 2 to 3 times higher than white women. And a lot of folks ask, why is that? What is it about that the African-American woman death rates are so much higher? And you think about it, contributing factors do include implicit bias, provider dismissal. I can go into, and this is not just what we're saying, when I was in federal, it was also echoed. I can go into a hospital or a doctor's office, I can go see an OBGYN, and they can send me home, and my same white counterpart can go in, and they will see them. And it makes the person feel afraid to even ask questions, and you know what I'm talking about. Even ask questions. The more questions you ask, the more frustrated the doctor becomes, right? And so we have seen that contribute to morbidity and mortality issues. The next thing is structural racism, institutional barriers, right? When you think about the barriers, you got transportation issues, the hospital quality, not just the quality of hospital, how about we talk about hospital closures, right? That's happening in the areas that need it the most. And then a couple of others is the chronic stress, the ongoing physiological wear due to life stressors, hypertension, Also, us as Black women have a higher burden of comorbidities, right? So we're looking at hypertension, obesity, diabetes, and that's why I'm so excited, because on the tour we partner with Walmart, who has an amazing nutritional platform that they're pushing on every leg of the tour. We actually have cooking demonstrations to teach even how to eat healthy. And then the access, right, and continuity gaps. We find that 30% of the morbidity issues is largely due to them missing their prenatal appointments. They don't go, right? And then you have the fragmented postpartum follow-up, difficulties navigating the system, and then there's this big word called preeclampsia, right? And that has been misdiagnosed a lot. And I do know for a fact that, those symptoms, they sometimes prescribe, like, take a Tylenol, you'll be okay. But taking a Tylenol, you'll be okay is not the answer. You're not going to be okay with a Tylenol and preeclampsia, right? And so that's sort of like, it's something that occurs mostly in Black women, more so in Black women than their white counterpart.
Could you describe what it is?
Yeah, it's like, when you think of preeclampsia, and I got some medical experts here as well, but you can have the headaches that can come with it, and sometimes you feel like you can't even lift your eyes, and it can be accompanied with dizziness, and you can feel extremely tired as well. Doctor? High blood pressure is tied to that. And so it's easy to misdiagnose that, right? But it doesn't have to be misdiagnosed. Mm-hmm. But here's my alarming facts. This is what drove me to really engage in this work. When you know that over 80% of all pregnancy-related deaths are preventable. Preventable. So here it is, the United States has having the highest maternal mortality rate than any developed nation in the world. We already know the stats between race, but then we recognize that over 80% of all pregnancy-related deaths are preventable. Now that's nationally. You can go to some cities and it exceeds 80%. Atlanta, Georgia, exceeds 80%. Preventable. So my thought, with the Reverend hat on, Reverend Dot, right, is if it pains the heart of God, it should pain us. Right? And I always say, what saddens you is what you're assigned to heal. What angers you is what you're assigned to solve. Destiny and purpose kissing, that's when you know you're on that right path. But let's look at some of the leading causes of pregnancy-related deaths. I'm going to just talk about the 6 most frequent underlying causes of pregnancy-related deaths. Mental health conditions, cardiovascular conditions, infection, hemorrhage, obstetric embolism, hypertensive disorders of pregnancy. Those are the 6 leading causes of death. Because we're in New York, I'm just going to give you a high level, and we're going to do some interaction here, so I'm not going to be a total talking head here the whole time. But because we're in New York, and we're looking at their maternal mortality rate, 22.4 per 100,000, and this is between the years of 2018 and 2022, their preventability was reviewed at 74%. Now, in all honesty, when you speak to others from, like when I was with Health and Hospital System, they had mentioned they had a 90% preventable rate at 1 year. But they are doing more work in New York to address maternal mortality, which I am proud of. As far as the role of discrimination, a likely contributing factor in about 47% of New York pregnancy-related deaths. When we look at the national landscape, it showed that it fell to 18.6 per 100,000 in 2023 after a pandemic peak, but remains high versus their peer nations. So, and this is what I put in parentheses, improvement isn't victory, because the rates are still unacceptable, especially for Black moms. So I don't know if everyone here is from New York, but these are the states, and again, there's more than 10 states that have an F rating in maternal mortality. So Tennessee, Mississippi, Alabama, Louisiana, Kentucky, Virginia, South Carolina, Georgia, Indiana, Arizona. I was also know that Arkansas needs to be on this list as well. And I'm gonna tell you how bad it is in Mississippi. I was working with a house of worship there, and still am, because he's actually building a maternal health clinic. And he says that the moment someone gets pregnant in this area of Mississippi, they schedule a C-section. It's not even, I couldn't even, like right now, I'm stuttering. That's what I was doing when he was talking. I said, excuse me, can you say that again? They said, yeah. In this area of Mississippi, when they call the doctor's office, they automatically schedule a C-section. I want to talk a little bit about the mental health, and then I'm going to stop, and I want us to do some interaction. When you think about postpartum depression, and my daughter did suffer with postpartum depression, and here are just some of the symptoms. She had it after her second child, and she had it, but she now knows how to navigate those waters after her third. So I'm happy about that. You see the symptoms here. It's a mood disorder that can affect women and sometimes men after childbirth, marked by persistent sadness, anxiety, hopelessness, or loss of interest in usual activities. It is more intense and longer lasting than the short-term baby blues, which usually resolve within 2 weeks after delivery. But without treatment, postpartum depression can impair maternal health, infant bonding, and child development, but it is highly treatable through counseling, support groups, and when indicated, medication. So maternal mental health, as I shared with you, I did serve on the Maternal Mental Health Task Force at the United States Department of Health and Human Services. And we just left there knowing we, as a nation, have an F rating here. So the leading driver, mental health and substance use conditions are a top underlying cause of pregnancy-related deaths nationally. Before, we would only say we only say suicide is the leading cause. Now we're saying suicide and substance use disorder are the leading causes of death. About 1 in 5 to 1 in 4 deaths involve mental health conditions. The prevalence is 15 to 20% of pregnant postpartum New Yorkers experience depression or anxiety. But when we look at it overall, the United States, it's 1 in 5 women. Postpartum depression alone affects about 1 in 7 mothers. That's 14% nationwide. And the rates of diagnosed postpartum depression nearly doubled from 9.4 to 19% in 2021. So when the data comes out again in the next several years, we have seen an increase. So they are the leading underlying cause of pregnancy-related deaths in the United States, according to CDC 2022. I need to paint this picture because really this is really about our call to action, but you got to know what you're up against to know how to act. So only 50% or fewer of women with maternal mental health symptoms ever receive treatment. You got stigma. They don't even know that it's depression. They're thinking, this is just how it is, and this is how, I'm going to get over it. They're not being properly diagnosed. And then you have the disparities that exist. So if we miss depression, we miss the chance to save lives. One of the things that we always say is, it's okay not to be okay. It's just not okay not to get help. It's okay not to be okay. It's just not okay not to get help. There are two numbers you can write down if you work in this space, and you can share it with those that you love and care about. One is 988. That was released while I was in federal. That is our crisis lifeline, suicide prevention lifeline, in several different languages, 24/7 chat, text, call. You don't have to disclose your immigration status, totally confidential. When we released the text feature, we saw an increase with youth. And so 988, and then the other one is 833 TLC MAMA. TLC MAMA, that was released by HRSA, Human Resources Services Administration. Okay, so I'm going to ask Lori if you could pass this out. And these are just, they're the same too. Yeah, they're the same. And this is if you're working with mothers, if you're working with parents, if you're working with families, new moms, be on the lookout for depression, anxiety. It just gives them some practical steps. You can give them several, because we have a small crowd, so they can take several. But we have to pay attention to mental health. And can I dare say, even our own in this room, right? Yeah. Okay, so why is it that so few women receive maternal mental health treatment? And this is what you need to know. It's the stigma and the shame. It's the lack of screening and early detection. It's limited access to providers, insurance and cost barriers, cultural and language barriers, logistical and life barriers, and missed touch points. So we can be a faith leader and not even know what the signs are for mental health or when they need services. And so we're going to talk a little bit about that. And we're going to talk about what the faith community can do. But before we get into that, I just needed to paint this landscape so that you can really understand. Testing, okay. Yeah, so you can really understand what we're up against in the nation, right? And I feel that the way we talk about drug addiction, right? Helping people in the criminal justice system, this is an equally important conversation. Maternal health, infant health. And so I want to hear from you before I talk about what the faith community can do, what your organization does. Are you part of a church? And start thinking through what are some of the things that you can do in your own space. So what we're going to do is we're going to break up into groups, because for me, it's important to create this accountability space. So if we can just count, let me see, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, easily divided, visible, 4. Let's do groups of 4. Let's have 4 groups, and I'm going to give you your instructions on what you need to do with the group once you form. 4 groups, plus 1. So great to see a dad here. Yes! 4 to 5 in a group. 3, 4. 4, I need 1 over here. I just need 1 over here. And 1 over here. And then you can just join any of the 4. One group will have 5. I'm sorry, I do need to give you a guiding question. I know how does faith either positively or negatively influence whether mothers seek help? How does faith, and what messages, spoken or unspoken, might women in your congregation hear about strength, motherhood, or suffering? And you're doing this part now, and in what ways could the sermons and small groups or women's ministry create safer spaces for mothers to share their struggles? And how can we balance prayer and faith with the reality that mental health requires professional support too? Okay, continue. Okay, get ready to be able to report out. We're going to get ready to report out. Remember the specific questions that we had. We're going to give you another 3 minutes. Another 3 minutes. Think through ways in your respective locations, etc., to improve. Think about the questions I asked on the faith level, in the beginning, just in case I need to repeat it. Let me do it real quick. But you can continue. We'll be shifting in about 5 minutes. We'll shift in 5.
Yeah, and so people are reporting.
Okay. Well, I see that we've engaged in some real robust conversation as we're looking at this atrocity, but as we said, preventable, right? So what are some of those action steps look like? But I'm going to turn it over to whomever you designated as the spokesperson. Lori's so excited to start. Okay, so.
Well, I'm about to turn it over to Reverend Dr. Cynthia Diaz because she's amazing. But in our group.
1 second, let me get you a mic.
Oh, yeah.
Test.
Okay, great. Thank you. First of all, in our group, we talked about how grateful we are that you are presenting about this because it's so necessary in all of us. But yes.
Thank you.
The first thing we talked about is how we are each other's keeper, and we need to be the eyes looking out for warning signs and red flags in each other, and to help each other and almost make that pact ahead of time, like, I'm going to take care of you, you take care of me, and I will have an intervention, or I will go to your loved one or your spouse and help an intervention if help is needed. Sometimes, as you brought up, our faith sometimes can inhibit us from asking for help if we think that there's something wrong with us because I haven't prayed enough, or haven't read my scriptures, or I'm not in tune enough with God to understand this problem, and something's wrong with me. Yeah. And we do that instead of asking for the help. Yeah. And so that can get in the way. But one thing I wanted to highlight is Reverend Dr. Cynthia Diaz said in her congregation, she's a faith leader, and they have a 5-minute wellness moment at the right before their message at church. And it's a variety of topics, and they have a variety of presenters, and it normalizes these mental health challenges. And then she does a brilliant thing where she says, if you would like to talk more, or if you'd like more information, here's the resources, and we do it at the end. So the nice thing is because you're doing it right before worship services, you get the maximum amount of people involved. It's not like on Tuesday night, if you want to come to this presentation, you'll get 10 people. But she does it as part of when the whole congregation is together, which is incredible. And this was born out of a difficult situation that her personal family had with COVID. So thank you for paying that forward.
Yeah, thank you.
Hi. So our group, we spoke a lot about the experiences of some of the women in our group, as well as some of the practices that we have in our houses of worship. And so 2 of our women here both have 6 children and have experienced different things in the process of giving birth. We both shared that neither of us have children, but that there are some concerns that the younger generation has. As a Black woman, I'm scared to death sometimes when I think about the possibility of having a child because of the mortality rate. But some of the best practices that we discussed that we're doing in our congregations is in the LDS, right? They have a system where if you give birth, there's like a ministry component to it, and so you're assigned someone that's going to stay on top of you and follow you through the cycle of postpartum. And I was speaking about something that my family's nonprofit does, where we do a community baby shower, which gives us access to pregnant women all across the community, and then we're able to have all of the maternal health providers there. And then also in my church, we started a forum called Restore Her, where we bring the mental health providers to the church, and we have this really intimate conversation with women about postpartum depression and all the things neonatal. So those are some of the things that we discussed, and we also had, tell me your name again. Okay, she mentioned that there's just more education needed for the younger generation, because we hear a lot of negative things about birth and being a parent, but we need to really present some of this information in a more positive light.
Great, thank you.
Our group, we have a great group. But some of the practical things that came out of it for me, I had a little eureka, was that one of the things we could do to help our congregation, particularly black women, is help them interface with their medical professionals and help them get to appointments. I know in my congregation, someone will call and say, I need help. You know, we go to the doctor with the older women. We take them and write notes and call their daughter and tell them what the doctor says. But in the case of a black woman who's expecting a baby, she would benefit from right from the beginning to have a companion go to those appointments, maybe help her get to the appointments, with transportation as a recurring problem. And that seems like something really practical we could do. The other thing my good friend here mentioned was that not to assume what people need. And the first question is, how can I help you?
Yeah.
Listen, how can I help you? And when we see people, it's very hard not to label and judge and assume things, but we need to, they're masters of their fate. They know more about themselves than we do, and we need to just say, how can I help you, and respond to that. Is there anything else? I'm really inspired.
Thank you.
I am really inspired.
Great jobs.
Hi, good afternoon, everybody. Equally inspired by my group members. I think the biggest thing we identified is that the answer is in the room. Amongst us, we have basically 12 children. I'm one on the way. So we identified that we have gone through this process, and a lot of it we have gone through alone. And then as we had more children, we knew more. Right? So harvesting the information that we have within our faith communities could be really beneficial as we address the maternal health crisis. We also identified that it is not just the maternal health crisis, it is the family crisis. We have to include the dads in the room, right? So identifying ways that we can create spaces for fathers to develop as better fathers, to be better not only for themselves, but also for their child. We also talked about access to resources, but also depleting resources in the community. So we talk a lot about hospitals closing, but we're not talking about the community-based services that are also being removed from the communities that need it most. Is there anything else? Okay.
Wow. Wow. We could have kept going. Yes.
If I could just give a brief testimony. Hi, I'm Cynthia Diaz. Next Tuesday, God willing, my firstborn grandchild will be 4 years old, October 14th, 2021. My son and Messiah's mother are not married, and they're not even together now, but at the time they were not married. She is African American, she's Trinidadian. She drives a Tesla. Economics was not a factor in terms of her getting to the doctor, the best health care. My son went with her to every prenatal appointment. And the doctor, she is not one, she's a law enforcement officer, but she is shy and soft-spoken and not quick to ask questions of healthcare professionals. This was her third child, so she was not a new mother. The doctor, my son, on the other hand, was raised by me and his father, who's in law enforcement. I'm an attorney, and he is used to cross-examining people because he was raised being cross-examined. The doctor had major issues with every question that my son asked. And he very specifically would turn to Melissa and he would say, I don't have to answer his questions, this is your child. And it became so exacerbated that this Dr. A insisted early on that she was going to have a C-section. My son raised a lot of questions. Why are you assuming it's going to be a C-section? What are the indicators and stuff? He refused to answer. Secondly, the doctor then went a step further and wanted her to sign to have a hysterectomy at birth. And so my son was going ballistic, right? But she was like, no, he's a good doctor. This is a good hospital. This was out in Suffolk County, Long Island. God intervened in a very strange way. She contracted COVID. She was very, very ill. She called the doctor. He said, do not come to the office. I cannot see you. Your C-section is scheduled for the 21st. This is mid-October. And I'll see you at the C-section, take some aspirin or Tylenol, something to that effect. She was not eating or drinking anything for 2 days. I contacted a member of my church who's a physician who also worked in the LIJ system. Dr. Reed said, immediately take her to the Women's Hospital, LIJ, right now. Don't hesitate. And Melissa was like, well, no, the doctor might not like it. I mean, this is an educated, intelligent woman. I mean, none of the barriers that we think about that prevent a woman from getting care. I called my son. We got her to the hospital. She was on the brink of death. Her vitals were so bad that they could not perform a C-section. And so there was for 24 hours, the doctors were on the fence. 1 hour, it was like, we have to get the baby right away. She was severely hydrated. The next hour was like, no, we'll lose the mother, no, we'll lose the child. To God be the glory. On October 14th, as it happened, a very good friend of mine, who's also a member of a prior church, somebody who had traveled to Cuba, and he was the physician in charge of maternal health. They called him in to perform the C-section, him not knowing was my son, who he had known since a childhood. And he brought in the whole team, and they saved the mother and child.
Thank you. That is incredible.
24 hours,
Yeah.
I sat in front of that hospital because it was COVID. I couldn't go in. And I prayed and I prayed. But I prayed along with tapping into the resources that I had, because Dr. Reed was on the phone and she was ensuring she was in communication with the doctors.
Yeah.
And so, you know, it's not one broad stroke.
No, it
it's like
isn't.
poor women. No, it can happen to
That's right.
anybody.
That's right. That's right. When you think about it, you hear the stories from the tennis player, etc. I know we're at time. Thanks for sharing. We're at time. About only have 5 minutes. I can't believe the time went so quickly. But you know, we talked about hearing, asking for help, being each other's keeper. Love the whole wellness check-in. We talked about the various ways we're interacting with our houses of worship and the community. Houses of worship, I always say we should be churches without walls, right? Community focused, and not just thinking about, you know, our wall color and our chandelier and all that other stuff, but that's okay in its own right. But really, I am really advocating for our houses of worship, those that lead with faith, to understand that if it pains the heart of God, it should indeed pain us. It should indeed pain us, and this does pain God's heart. I always say, too, listening, we heard a lot about the fact that we have not been effective listeners. A lot of times we think it's just, let's just hit it with the scripture in verse, but sometimes we need to step back to hear, right? The most effective means of communication is in our ability to listen. We talked about, we're hearing about the hospital closures, but I want to go through some of the things that I'm going to recommend to you as people of faith. We talked about interface, building the village. To me, that is the one thing I really want to emphasize. Community-driven, village sustained. Community-driven, village sustained. That's what we need to be. We can't rely heavily on federal, on state, and city. We need to become that village, right? We need to reimagine partnerships. I've had so many conversations with those that have, since I've left federal, Health and Human Services, of faith leaders, feeling like they're going to crumble because X amount of percentage of the programs were funded by. So how do we reimagine movement and addressing these critical issues in light of the current climate that we're in? The other thing I want to talk through is what we can do. So I Elevate Health, we actually have the Thrive Tour. We go into a city that has the high maternal mortality morbidity rates. We set up the programs. We actually throw the community baby shower just to get them in the door. We bring together the village to provide support. That village is my doulas, my midwives. It's the WIC program. It's my behavioral and mental health specialists, right? Which is very, very critical. As I told you, on the tour, when we did 200 cities, and I did it as a mom tour, connected over those 20,000 pregnant and postpartum parents. And when we did that, one of the exhibitors that was really most frequently visited was the behavioral and mental health tables. And what we do in the very beginning, we educate them. We teach them how to advocate for themselves in healthcare setting. Hey, you can download, I forgot to mention, download that code and we can stay connected. And then you can tell me which area you'd like to explore further, even after this conference, even after this session. And so once they're connected, the last thing that we're added on the Thrive Tour is now we're connecting with houses of worship so that we can set up maternal health hubs within houses of worship. What does a hub look like? It all depends on the house of worship, right? When not all houses of worship have the ability to identify a psychologist, a psychiatrist, a doula, or a midwife, but what you do have the ability to do is to empower your lay leaders to become ambassadors in this work. We have written the first evidence-informed curriculum for the faith community on improving maternal health outcomes. How do we better support our pregnant and postpartum parents? And so I would say train Thrive ambassadors. They're your trusted lay leaders, right? Through our Thrive Together curriculum to learn how to better support pregnant and postpartum parents. You can host informational, educational sessions on key national holidays. I mean, there's a maternal health week, there's a Black maternal health week, there's a maternal mental health week, right? So think through, how do we elevate the messages and create the information and educational forums during this time? What can we do in our bulletins? What can we share on our Instagram? What can we share in our social media posts? What are the different things that we can do that's really just practical? Real practical. Then you can bring in the experts. You can have your own panel of experts, and I can help you know who they are around our nation, right? Who are my OBGYNs that I need to bring into my house of worship this Sunday or Saturday or whatever day you decide? Who are the doulas that can talk about, here, this is the role of a doula. And in some states, since they've expanded Medicaid, and I know we got to go, since they've expanded Medicaid, they reimburse doulas. So the women don't have to pay, right? And a lot of people don't even know that. So that's something we need to think about. Next thing I would say is, who in your congregation have an interest in becoming a doula? As I mentioned, we certified almost 600 culturally competent doulas on that 50-city tour. Do you want to build referral loops with local OBGYNs, the doulas, the federally qualified housing centers, behavioral health, home visiting programs? Bring the village together, because they're the ones that are going to provide support to them. Your house of worship can literally just be a place where once these individuals are trained as ambassadors, they will hold 8 sessions with these pregnant and postpartum women, and then we'll be able to monitor the outcomes after. And then we can advocate for the mental health coverage, depending on the city or state that you're in, doula reimbursement, and closing care deserts. And then we're committed. If you download that code, we're committed to help you set up the affiliate. We're committed to do the ambassador training. We're committed to creating the connections for you, the clinical partners, doula networks, and community health networks. And then outside of that, this is our next steps. I would love for you to become an Elevate Health affiliate. I would love to see you enroll your staff in the next Thrive Ambassador cohort. And then we can schedule a site readiness walkthrough at your house of worship. And it may not be full blown. It may just be the 8 sessions. You bring 30 women together for 8 sessions. And that would be your involvement. Outside of that, you now will have a connected village that you can refer them to. Because again, it's not us about being Superman, right? We don't know all things and we can't do all things. But it is about us connecting. So I'm going to end there. But here is my information. Please let's stay in touch. I always say health equity is a charity, it's justice. A healthier future for all begins with fairness today. Thank you all for your time.
All right, we'd like to thank Reverend Dr. Q English for her passion, for her work, and for all of her service, and especially her faith. Thank you so much for being with us.
These to pass out.